So when people have surgery, people think that the surgery is the most important part, which it really is. Well, there's the second part after surgery, which is like the aftercare.
Oh, yes.
The compression garments, the positioning, all the things that kind of make a good result into an excellent result. So after surgery, I generally put people in a stage 1 compression garment. And as time goes on and the swelling starts to go down, when they're under the care of a trained lymphatic massage therapist such as yourself, you're able to recognize, oh, I think the patient may need something a little bit more, or to like define things or refine things a little bit more. Kind of tell me what your process is when you do that.
So normally 100% of clients come in either with a binder or a stage 1 faja. And after about a week, so I normally say week 2, stage 2, because that first initial week they lose so much and they already coming out in like a triple their size because of the extra swelling. So a medium person might come out in an extra large faja. Mm-hmm. So of course, by that next week, they need more compression, which is the stage 2 faja. And this doubles the compression for yours. Now we might stay at the same size, but it's double the compression. So with this faja, we'll get her in or him in. And then depending on the level or the size, they have 3 different levels to go through. So what they would do with this foam, if it's space and if they can tolerate it, is put this foam, you slide it in the front. Most people, I tell, cut in half. So you cut this in half, you put one in the front, long ways or sides to kind of do the sides and compress those. And then these are more for ones who can't tolerate the hardness of the board, or that's leaving marks. So as soon as I see marks, we say, let's discontinue it until we don't see marks. So we'll go back to the softness. But this is the backboard, mostly because the lower back, they have swelling the most. So this will go here inside their faja or the waist trainer, and it'll compress the back. And then simultaneously or separately, if they can't tolerate it, you put the front board in, which is good for right here in between the breasts, which holds a lot of fluid, and then lower. So this covers kind of the whole torso. And then with this compression, with the faja, they're getting the most compression that they can get. They can wear it without it. Once they get 3 weeks in, 4 weeks in, that's about the time that they usually discontinue these.
I think you made a really important point there when you talk about marks, because some marks with a garment or with a binder or the faja is okay.
Right.
But then it takes a trained individual to recognize that, no, these types of marks are not okay. Sure. We need to go with a little bit less aggressive compression.
For sure.
Yeah.
And every person is different. Stage 2 waist trainer would be the other option rather than the stage 2 faja. So Dr. Masters, would you like to try one on just to see the compression that your clients are in?
I don't know.
I think you should. Just go ahead and try it.
I guess
so this might be a little big for you, but you'll get the idea. So yeah, you zip it on up.
Try to suck this in.
You already snatched it, Dr. And they should be independent for this by the time we put them in this. And then you got your top compression.
I like that. That's really soft.
Really solid as well. And it keeps good posture. And if we had a good size for you, you'll see the real benefit. So.
Yeah. So what I like about this is are the zones where it's giving compression. Mm-hmm. The first area, I call this like the donut of doom. Whenever you have the tummy tuck and the incision goes right here, the lymph nodes, which actually absorb all the lymphatic fluid, are right here in the inguinal area, right? Sure. So when the incision comes close to that, it's almost like we've created a brick wall. Yes. Not allowing that fluid to get there.
Yes. Sir.
So, we're relying on the lymphatics that are within the dermis of the skin and the lymphatics that are within the fascia of the muscle to kind of do the work of these lymph nodes, correct?
Yep.
So this area, the donut of doom, as I say, is the area that gets kind of swollen. And I like how this band just kind of goes over that.
Yeah, and you can manipulate it up or down.
Yeah.
So that's so true. And I call it like the dam of the scar tissue too that's creating from that incision line. Yeah. So my thing, I myself had 3 C-sections. So my thing working that incision line and getting that, like I love the pops. When you get some good scar tissue breakup, you're going to feel the pops. So I train our clients to go home and do that as well, to break up that dam, to let that fluid flow through, to drain right here. So. That's
Yeah,
my ideal.
I'm glad you mentioned the pops because our nursing staff, and I'll get questions about this.
Hmm.
My patients have my phone number, so they'll shoot me a text message saying like, "Hey, I felt a pop. Am I okay?"
Yeah.
And I generally tell them that's that internal scar tissue
Yes.
that's kind of breaking up.
Yeah.
And so, having a trained individual actually apply massage and breaking up that scar tissue and preventing a condition like fibrosis from
Yes,
developing
sir.
early on is
Yes,
really
sir.
important.
I
Yeah.
agree. Yes,
Yeah.
sir.
Well, I really appreciate you coming in today and kind of going over with what you do because, it's really important that patients have an understanding in terms of, why lymphatic massage is important for post liposuction and body contouring procedures.
Hmm.
So thank you very much,
No,
Dani.
thank you for having me, and I appreciate it. You keep up the good work you're doing.
Oh, thank you.
You're
I
bringing the
appreciate
quality
that.
of life up to these people.